Hey you guys, this is Isaac. Happy Friday. I am here to bring you our discussion video today. But before we get into that, I have some awesome news. For those of you who have been watching and following me through this journey and following me through these videos, I had a doctor's appointment today and I'm doing great. My T cell count went from 285 to 377, which is a good thing. My viral load has dropped to being non-detectable, which is a excellent thing. I'm so happy. I mean, although it's only been 2 months since I was diagnosed HIV positive, these last 2 months have been something else. Anxiety levels run high, not knowing what's really going on, not really knowing if the medicine is working. Um, I know I said yes in my previous video. I want to say that was a video from yesterday that I said, I feel that the medicine was working, and it has been. It's proof. I'm living proof. There are many other people that are living proof, but those of you that don't know someone personally who is affected by this virus, I'm living proof that taking these medicines work. It's the best way. I'm beyond elated. I hope within the next 3 months when I go to the doctor again that those T cell levels, those CD4 cells, they'll be up in the 500s where they should be. And the viral load has dropped even lower, hopefully in the next 3 months as well. So you guys, thank you. Keep me in your prayers. I know I've been praying. Yeah. I'm over elated and enjoyed about that. That's why today this video is gonna be talking about how you, for those of you who are out there who are HIV negative and would like to say that way, could prevent yourself from catching this virus. Today we're going to be talking about two different types of medicines. The first one is called the pre-exposure prophylaxis, and the other is the post-exposure prophylaxis. I talked about this on yesterday. Just a hint on it, and I was telling you guys that me and a friend of mine said he was gonna start taking this pre-exposure prophylaxis, and we sort of got into a debate over exactly what it is. I felt that the information that was given to him was not the best way to put this in to put exactly what the medicine does. Um, so I wanted to wait to do this video in particular until after I spoke with my healthcare team and find out more. I like to do in-depth research. I just can't I just can't go off of what's being told by people who may have been taking this medicine or by some healthcare professionals that recommend this medicine, because what was relayed to me that the medicine just basically prevents you from catching the virus. Um, but we're gonna get into that, and I'm gonna go into a little bit of that. Um, but after speaking to my doctor and other members of the healthcare team that's taking care of me through this process, the pre-exposure prophylaxis is two HIV medicines that are used to prevent or control the spread of an infection or disease. Okay? Of the infection or disease. What the pre-exposure prophylaxis does is that if you come in contact with the virus through sexual contact, and you are taking this pre-exposure, or pre-EP is what I'm going to call it, so I won't have to say that prophylaxis word over and over. Pre-EP, that's what we can call it for short. If you are taking the pre-EP and you come in contact with this virus, what the pre-EP does, it does not prevent you from catching the virus. It lowers your risk. What do I mean when I say lowering your risk? Meaning that you still have to get an HIV test, before and after you start taking this medicine. PrEP is a powerful HIV prevention tool. However, for sexually active people, no prevention strategy is 100% effective. Therefore, if you're using this PrEP, you should still be using other prevention methods, such as using condoms and getting HIV tests and other STD tests on the regular basis. Like I say, the pre-exposure prophylaxis does not prevent you from getting infected with the disease or the virus. It just lowers your risk. Lowering your risk means that while taking the medicine, since you are basically taking HIV medicines, the if I'm introvitamin, that's one of the medicines that are in the pre-exposure prophylaxis. What that medicine does is stops the virus from making copies of itself. It slows down the process of the virus. So it keeps you at a non-detectable state. Now, this is where it gets crucial, and this is probably where my misunderstanding of it came, and probably for others. When you hear the word prevent, you hear the word cure. There is no cure for HIV, unfortunately, at least not yet. You know, all this, like I said, I just have to stress that it's lowering your risk. So, who can use this PrEP? PrEP is not for everyone. PrEP is only considered for people who are HIV negative and at a substantial risk for HIV infection. Meaning, if you are in a sexual relationship with someone that you know is HIV positive, you should be taking this medicine. It could be highly effective. If you are pregnant, this medicine is also something that you could possibly look into to help probably not transfer the virus to your child during childbirth. Um, but yes, this is not for people who are HIV positive. We have a whole other list of medicines which I talked about. Well, which I talked about the one that I take yesterday, and I left the list in the description of the ones we have. But back to who can use this PrEP. If you are in an ongoing relationship with an HIV-infected partner, if you are not in a mutual monogamous, which is another thing that we talked about yesterday, monogamous relationship with a partner who has recently tested HIV negative and is a gay or bisexual man who has had sex with another man without using protection, i.e. condoms, or been diagnosed with a sexually transmitted disease within the past 6 months, you should consider taking this medicine. Having other sexually transmitted diseases does heighten your risk for being exposed to the virus. It does heighten your risk, which is something I don't think I've mentioned in past videos, that your risk is heightened. Heterosexual men and women who do not regularly use condoms when having sex with partners, you are at a risk for HIV. As I've said before, this isn't just a gay disease. This isn't just, you know, this is a human disease and it affects everyone. So, if you're dating someone that you know is an addictive drug user or a bisexual male, um, you should consider taking this medicine. It's very, very effective. For heterosexual couples where one partner is HIV negative and the other is not, you should be considered taking this medicine. From what my doctor has told me, that once again, it does not stop you from catching the virus. It lowers your risk, and it lowers your risk by stopping the virus before it starts making copies of itself within your body. Now, if you're taking this medicine and you are engaging in risky behavior, then all of a sudden you stop taking this medicine because you feel as if, well, I'm fine. I'm not going to catch it. That's not the case. This is a medicine that you would have to, take on a daily basis if you are that type of person. Um, like I said earlier, it may be a powerful prevention tool, but no prevention method is actually 100% effective. So if you're taking this PrEP medication, you should still be using condoms. You should still be getting HIV tests on the regular. You should still be getting other STD tests on the regular with your partners. You should still be trying to choose less risky sexual behaviors. And if you inject drugs, I don't knock what nobody do. Just be self-sufficient, self-supporting to your own contribution. Use your own needles. Don't share needles with people. Make sure that your equipment is sterile. I know it may sound like I'm condoning drug use, especially injection drug use. I can't tell someone else how to live their life. So if that's what a person wants to do, who am I to say, don't jump off that ledge. That's all I can tell you to do is don't jump off that ledge. You might not want to be doing that. Another question that I brought up with my doctor was, is PrEP a vaccine? No, it is not a vaccine. The medicine is not injected. It does not work the same way as a vaccine. For those of you that don't know how vaccine works, what vaccines do, they inject a inactive part of a virus. Let's say let's use flu for example. When you get the flu vaccine, they inject an inactive flu virus inside of you so your body knows what it looks like and knows how to fight it. You don't catch the flu. It's a vaccine. Um, so no, PrEP is not a vaccine. It does not work like that, because if it was a vaccine, that means it would be a cure. And like I said, there is no cure for HIV just yet. The medications that are in the PrEP is, once again, like I told you, one of them is intracytabine, and the other is tenofovir. Tenofovir. I'm trying to say these words the best of my ability. Once again, I leave everything down there in the description. So, but these are the two medicines that are in PrEP. The brand name is called Truvada. I think I've seen commercials about this. I'm not a avid TV watcher. I spend a lot of time on the computer because I just do a lot of homework. And when I do watch television, it's not for the commercials. Thank God for DVR. You know what I'm saying? I'll be trying to get past those commercials. But I think I have seen a commercial talking about this. Like I said, these medicines work by blocking important pathways that HIV uses to set up an infection. If you take PrEP daily, the presence of the medicine in your bloodstream can often stop HIV from taking hold and spreading in your body. So that brings me back to say, it does not stop you from getting infected with the virus, but it stops it from spreading. That's what I read, and that's what I hear when these things are told to me, and when this is what the information is that's giving me. Looking at my notes here, where did I stop? HIV from taking hold and spreading in your body. If you do not take the PrEP every day, there may not be enough medicine in your bloodstream to block the virus. PrEP can only be prescribed by a healthcare provider and must be taken as directed to work. So, as I stated, it's like you're taking HIV medicines. The two medicines that you're taking are the, if I'm remembering correctly, they're the inhibitors, and they're the ones that are stopping the virus from copying and blocking it from spreading throughout your body. Studies have shown that PrEP does work pretty well. For someone who's taking their risk of getting HIV is 92% lower than those who didn't take this medicine. But like I say, it doesn't work if you do not take it on a daily basis. I'm gonna leave the information for this for the PrEP in the description, along with the next topic that we're gonna talk about, which is the post-exposure prophylaxis. Now, pre-exposure meaning this is the medicine that you take before you're exposed. Now, the post-exposure are for those people who believe that they have become in contact with the virus, and they want to make sure that they don't become HIV positive. Um, this is called the post-exposure. We're going to call it PEP, not pre, PEP. This is what we're going to call this one for short. The PEP involves taking an anti-HIV drug as soon as possible after being exposed. To be effective, the PEP must begin within 72 hours of exposure before the virus has time to rapidly replicate in your body. The PEP consists of about 2 or 3 antiretroviral medications that you take for 28 days. So unlike the pre-EP that you take daily, you only take this one for about a month. You can get the pre-EP from your doctor's office, emergency room, urgent care clinics, or local HIV clinics. The medication has serious side effects that can make it difficult to finish the program. But like I say, just like with the pre-EP, the PEP is not 100% effective, and it does not guarantee that someone exposed to HIV will not become infected with HIV. What the post-exposure prophylaxis involves, like I said, taking about 2 or 3 antiviral medications. There are 2 types of this medication. One is called occupational PEP. This is when taken when someone working in a healthcare setting is potentially exposed to the material infected, such as syringes, probably blood or other bodily fluids. Then there's another type of PEP which is the non-occupational. And this is taken when someone who is potentially exposed to the virus outside of the workplace, i.e. from sexual assault, during episodes of unprotected sex, or sharing injected drug needles. As I mentioned, that in order for this to be effective, you have to start taking it within 72 hours of exposure. Who needs PEP? Healthcare workers are evaluated for PEP if they are exposed after getting cut or stuck with a needle that was used to draw blood from a person who may be HIV positive. Hold on one second. I have to stop this before it closes. I can't stand when this scanner just, yes, interrupted. I'm sorry. The scanner just pops on and I don't understand. It just shuts down everything. But I need to get that fixed. Back to what I was saying. The PEP is used for healthcare workers that may have been cut or stuck with a needle that was used to draw blood from someone who may have HIV infection, or getting blood or other bodily fluids that may have a lot of HIV in their eyes or mouth, which I don't know how that would happen. But I guess it does happen. That's why they have the medicine. The risks of getting HIV infection these ways are extremely low, though. Fewer than 1 in 100 for all exposures account for that. But what you should keep in mind that the PEP should only be used in uncommon situations right after a potential HIV exposure. It is not a substitute for other proven HIV methods, such as using a condom consistently and correctly. Um, just to press pause real quick. This takes me back to the conversation that me and that friend of mine that we were having. As I said, I don't really like to talk about personal conversations, but this one sort of got to me because, you know, I like to do in-depth research. I like to get all the facts out there, and to me, he felt that taking the pre-EP is gonna stop him from becoming infected, especially since he engages in risky sexual behaviors. Um, and if he engages in those things on the regular, yes, the pre-EP, the pre-exposure prophylaxis is helpful, but neither one of these medicines are 100% effective in saying that you could not become HIV positive. If you engage in risky sexual behaviors, if you don't use other prevention methods such as using condoms and using condoms correctly, you're still putting yourself at risk. Taking this medicine or not taking this medicine, you're still putting yourself at risk. I can't stress that enough because it puts me at a concern for people who believe that this medicine is like the cure for HIV. Um, I'm gonna try to do this, trying to say this much without being emotional, because if there was a cure, if this was a cure for the virus, I would want it. Although I know I just said good news early in the video, my T cells are up. The medicines that I'm taking are working. So that means these medicines that they have in the pre-exposure prophylaxis and the post-exposure prophylaxis work as well to stop and prevent the virus from spreading in a person who is HIV negative and would like to remain HIV negative. But like I say, there's not 100% guarantee that you won't become infected if you're engaging in risky sexual behavior. Um, This brings me to say, as I've been saying, it's very important about using condoms, getting tested on the regular. If you're taking the post-exposure, not the post-exposure, the pre-exposure prophylaxis, you still have to be tested every 3 months, just to make sure that the medicine is working for you. Because if the medicine is not working for you and you think that it is, if you come in contact with the virus or you knowingly sleep with someone who is HIV positive and you think, well, hey, I'm taking the pre-exposure prophylaxis so nothing won't happen to me, that's not the case. Something could happen to you. Um, so it's very important that you still go and get tested. Even after you take the post-exposure prophylaxis, it's very important that you go to get tested. Because although you may take that medicine for 28 days, it may not work. Um, Medicines respond differently to different people. It all depends on the type of lifestyle that you lead. What is your daily diet? Do you exercise? What is your genetic background? A lot of those things play a factor in if these medicines are going to work for your body. Hypothetically speaking, if the medicine I was taking was not working for me, I would not be taking just one pill a day. I would be taking, maybe 6 pills 2 times a day or 3 pills 2 times a day, until we find the right method for me. Right now, I'm happy to say that the struggle is working. Um, Frequently asked questions about this. If you keep having unprotected sex with someone who's HIV positive, can I keep taking the PrEP to stay safe? Once again, the PrEP is for post exposure. That means after you've been exposed. So if you take this medicine and you continue to have sex with a person that you know is HIV positive, it's recommended that you take the PrEP, um, just to help lower your risk. So I don't know how much more I'm going to stress on this. Like I said, I've been trying to keep these videos under 20 minutes. That last one was like 34. If you sit there and listen to me talk for 34 minutes, because I know I can ramble and get off subject, thank you. But I'm giving you some valuable information. And I always leave the information in the description just in case there's something I did not say or did not or missed or skipped over just for time's sake. This concludes our video. Today's topic was the pre-exposure prophylaxis and the post-exposure prophylaxis. I hope you guys are enjoying the videos and you're getting information. I hope that you are sharing these videos with friends, family, colleagues. I'm okay with telling my story. Now I'm really okay with it. So sharing these videos are just fine. I wouldn't be putting these on social media and out there to the public if I didn't care. Just to end on this note, my nonprofit organization, Love Bugs Foundation, we are underway. we are in the process of starting. These videos are going to be posted to our blog spot. I'm going to leave the link for that blog spot in the description. Everybody, please go check it out. If I don't post these videos to Facebook, 9 times out of 10, it's because I'm just posting them there. And it's going to be a lot of other information there, testings about testing centers and things of that nature, and the process, because I want you guys to help me with this foundation. This is a everyone foundation. I want everyone to get involved. I want to hear your ideas. What do you think we need? So feel free to comment on the blog at any time. Feel free to email me with questions or comment at any time. What do you feel that we need as far as to help stop the spread of HIV? What more can we do? Or for those of you that are HIV positive like myself, what type of assistance do you think we need? I mean, I know there's tons of government assistance that they have out there for us, but what about for those who don't qualify for that type of government assistance? What do you need? What would be helpful to you? So please, let's get this out there. Love Bugs Foundation, it's copyrighted. As far as I know, there's not another one. And when I applied for the copyright, nothing came back. So it is copyrighted. So no one else try to take my idea. If you do, maybe my lawyers will see you. I'm just joking. Just joking. But this is an everyone foundation. I want to be able to help everyone and get the information out there. So please feel free to email me at mrisaacjoseph@hotmail.com. You can also find me on Facebook at Izzy Joseph. Once again, that's Izzy ISSY Joseph. Or you can find me on Instagram at Izzy_Joseph. You guys have a wonderful day. I'm going to get to some homework. If you're going out tonight, have a couple of shots for me, preferably Patron. Everyone knows me, I love Patron. But I hope you guys have a wonderful night, and I will see you guys tomorrow. And we will be talking about something different. The topics are now just going to be coming at you random. Whatever I feel now that needs to be put out there. Just to keep the videos flowing, because like I said, I'm going to be doing these videos for 31 days, and I'm keeping to that commitment. So I'll see you guys tomorrow. Have fun. Be safe out there. No unprotected sex tonight. Weekends are those days that you just get hazy and you make questionable decisions. So make sure you take that condom, stick it in your back pocket, stick it in your wallet, stick it in your Terry Mugler handbag. A lady is never sure at night with a Terry. Baby, I love fashion. Stick it in your purses, stick it in your bras. Make sure you have that condom on deck if you plan on doing something risque tonight. I hope you guys have fun. Peace out. I love you all. Bye, love bugs. Bye.